I think it's incumbent upon us as individuals, patients, community members to take control of our health and be empowered to do so. And also for employers to do the same, because 180 million people get their healthcare coverage through employer-sponsored coverage, none of whom could afford it if it weren't for their employers.
Root is the functional medicine benefit for employers who are looking to help their people solve and prevent health issues at the root cause and lower their healthcare costs. Welcome back to Get to the Root. Today I'm joined by Kristen Rivers, SVP at Pareto Health. Kristen works closely with employers, navigating one of the most complex and rapidly changing areas of their businesses, healthcare. Kristen brings a unique perspective from the front lines, helping organizations rethink how they design, fund, and manage their health plans in a system that's becoming increasingly unstable. In this conversation, we're diving into the biggest shifts she's seeing in employer healthcare right now and what's actually driving those changes and where she believes things are headed next. So welcome, Kristen. Thanks so much for being here.
Erica, thank you so much for having me on. I'm such a big fan of yours and Rude, so it's truly an honor and excited for the conversation today.
The feeling's mutual. So, Kristen, you spend your time working directly with employers, navigating healthcare costs. What are you seeing right now that feels fundamentally different from even 2 to 3 years ago?
We're hearing and seeing a lot of the medical cost pressures and shifting. So just to give you a little bit of background on myself, I've been with Pareto Health for 4 years at this point. And prior to that, I was with UnitedHealth Group for a little over a decade, and in the pharmaceutical space and legal space prior to that. So we've seen a huge evolution and a shift over the course of time, specifically around a lot of medical cost pressures. There is a lot of life-changing therapies coming to market and medical innovation that's going to change lives for people. However, there's a high cost that's associated with that as well. And we're seeing that across the board. Also post-COVID, there's a lot of medical cost pressures. And I'd say uniquely in the last year and a half or so, we're seeing more and more employers start to hit that breaking point of they cannot continue to sustain the increases and they have to find ways to do things differently.
So what kind of ways are you seeing that people are making changes?
So historically, you saw like a lot of employers would, in traditional models, which are fully insured and level funded, really the only way that employers could save on premiums each year on their renewals is to cost shift onto their people, right? Increase deductibles, co-insurance, the actual cost of the insurance on the people. And any changes they could make would really be a detriment to those that are on the plan. And then you saw the shift into moving into how do we do cost containment differently, and move into a model of actually being able to help our people and save at the same time, which for most employers, I'd say like a year or two ago sounded like it was something that was too good to be true, but there are ways that they're able to do that. But it truly has to be around putting solutions in place that actually help address root causes, help to solve for issues versus just shifting costs around, whether it's onto people or new business discounts and a fully insured or level funded model.
Yes, I love that answer and getting to the root of the issue. So can you talk a little bit more about how people are kind of putting Band-Aids and fragments or different parts versus taking a truly proactive approach and what that could look like?
Yep. So I think there's a big perception within the space, both from employers and some brokers and consultants on you have to have a network like the Blues on your ID card or UnitedHealthcare or Aetna or Cigna on the ID card to truly solve for it. Depending on the model that employers and consultants choose to shift into could have its own restrictions. If we're talking about fully insured employers, you don't have much, you just don't have much control over being able to do anything. The solutions that are available to you and your employees are those that are offered by that insurance carrier. If you try to add anything or change anything, they're not going to allow it, or they're going to charge significantly for that solution to be put in place. As employers move down the spectrum of moving into self-insured models where they buy insurance for catastrophic situations, but they pay for their own claims up to a certain threshold, it starts to give them more flexibility depending on the model that they choose to go into. That's when they can start to, working with the right consultant partner or broker partner, they can really start to put things in place that answer to the needs of their population. I think first and foremost, you have to start with data and transparency and really be able to, you can't measure what you can't see, and you can't do anything about things that you can't see. So actually getting into a model where you can see what's going on to start to deploy things to really help people.
Can you kind of tie that into, what we're doing at Root with functional medicine? Because, finding the root cause and really empowering people with the right data, those are some of the great synergies here.
Yeah, I'll start with saying I think, and I'll tie some of my own personal health journey into this as well, because I think I would argue that I'm a recovering lawyer. You would say can advocate for myself and know how to navigate the system based on my background, but I've even needed help in certain regards. I feel like there's a shift into, we have to educate ourselves to be able to help ourselves and be a key stakeholder in this process for change, both as patients and as employers and as consultants. I guess that's 3 categories, right? And I think what you all are doing is helping people. Like you can change lives for people, but we as consumers of healthcare, so as patients or consumers of healthcare, have taken a passive approach to our healthcare. It's expensive, it's confusing, and it's hard to access, right? For a lot of folks, they get to a breaking point or they have to be really sick to actually engage in the healthcare space, and they're trying to engage when they really need it, versus taking an approach of what is going on with my health, what are the ways that I can address it, and how do I solve for it? So I've had a variety of chronic health issues myself. I have polycystic ovarian syndrome that's led to insulin resistance and a metabolic disorder for me. It pushed me into breaching type 2 diabetic levels. My initial pathway was also trying to go down a path of preserving my fertility, creating embryos that led to a lot of additional health issues for me. And in a traditional setting, I saw 9 different specialists. Everybody was treating me within the specialty that they were familiar with. And it was band-aiding, kind of similar to like what employers have had to do from a cost strategy perspective, band-aiding and medicating me in certain different areas within their specialty, but no one actually looking at anything and tying everything together. So when I was fortunate enough to be connected with you through Spencer, your team has helped. Let's take a step back and evaluate your labs, what you've gone through. Let's do some GI mapping for you to see what are the true drivers that are causing your health issues. If you left it up to, let's say, I don't want to call it the traditional medicine space, it's how bad. I'm actually going to back up and tell you a story that I waited 8 months to see and did the top endocrinologist in the space for everything I've been experiencing. And I've flown to Mayo Clinic. I've gone and seen providers to try to figure out the best way to manage my PCOS and keep it under control. So my mom passed away at 54, and it was likely due to a combination of factors, but she also had PCOS, but her symptoms were not managed that led to organ failure for her. I want to get in front of it. And I got my diagnosis shortly after she passed away. And I want to get in front of managing it. If you left it up to the specialists, I would be on a $300,000 specialty medication and a high cost claimant on my plan. And through the help with your team, I've been able to diet, exercise, nutrition, managing, an ever evolving, meeting regularly and figuring out what's working for my lifestyle and gaining a true understanding of what the drivers are for me and customizing my approach to life. Granted, I'm not on high cost specialty medication, but I've taken some supplements and gotten to a very good spot on being able to manage my condition well without having to be medicated. And I recall, so I went to this endocrinologist I waited, months and months and months to see, and was expecting these answers. And at the time I was experiencing some hypoglycemic dips where my blood sugar was dropping. I would spike into the 300 to 400s. It was also dropping into the 20s and 30s, which can be very dangerous. You could have a seizure, you could go into a coma. And, they're like, well, we're not really certain what could be causing it. And I'm like, I've done a lot of research. Could it be insulinomas? How do we find them? And they're like, well, we go home at 6 every day. We don't really do that, look into that for you. You're going to need to find a research hospital that has an intern sleeping on the floor who wants to run that level of testing. Because and how bad do you really feel? We could put you on this, and this medication. I'll subscribe all this. But if you feel like you're a 3 to 5 right now, we can get you to a 6 to 7, need to see you every 3 months, and we're going to prescribe all these meds. And in listening to all of this and having waited 8 months, the level of disappointment that I felt listening to this doctor, and they have their way of practicing medicine, which is to prescribe medications and manage a chronically ill patient. Whereas my care, and I remember listening to him and telling him, I don't think my philosophy around my care aligns with your philosophy on how you plan to manage patients. And you probably see a lot sicker patients than I do. I want to get in front of it. I want to manage my care. I don't want to be a high cost specialty drug claimant on my plan. I don't want to have to be dependent on drugs. I'm too young. There has got to be a better way. And really taking a position of advocacy for myself. Luckily, Spencer's heard me yelling and screaming about this for years now, I think, and connected me with you all. And where my health is today, there's no way I could have gotten there. And it is a gift to get to work with providers such as the ones on your team who truly take a proactive approach to care. And I think everybody should have access to that and be able to do this, because if how you measure a return on investment, right? So let's tie this into an employer's lens or a consultant's lens. If you can put tools and resources in the hands of people to help them manage their care proactively, help them be better consumers of healthcare and be the CEO of their own health, you're going to put them in a better spot to be a more productive employee, less chronic illness causing ups and downs during the day. I'm not feeling crashes. I'm more productive throughout the day because I'm actually able to manage my condition through how I manage my life, which I would not have been able to achieve without you guys.
Thank you so much, Kristen, for sharing your story. And unfortunately, I think a lot of people are going to relate, and not uncommon for the conventional health system to just want to manage things and continue people on the same path, just try to slightly improve symptoms without figuring out the why. And I'm so glad that you wanted to dig deeper and you felt empowered enough to say hey, this isn't working for me. I'm going to find something else. And I think that message is very powerful for everyone, listening to hear. And I also love how you said manage your life, because, it's just not one piece. It wasn't one medication that your body was missing. It was the whole picture. There's just so many things that you said I could click back on.
We're in this mode of instant gratification, right? If I need, I don't know, soap, we're out of soap. I'm going to click one button on Amazon and it's here. We're out of food. We got to order this and it's delivered within an instant. And something as important as your own health, which determines your life and your death, on all the things you do, people, we're in this instant gratification. I'm going to, walk into the ER or the urgent care to get care because, I need it now and I don't have time. People have to prioritize themselves to be able to manage their lives and for the future and empower themselves to live the best lives that they can. Chronically ill or not, underlying medical conditions or not, everything we put in our body, from food to supplements to medication, is going to determine our lifespan. and how well we get to live our lives. And we have to get, I feel like mentally we have to get out of this, like, I'm just going to deal with it when there's nothing else because it's too hard and we don't understand it. Employers have the power to put tools such as Root in the hands of their people to really give them a pathway to get to do this differently. So it isn't just going and seeing someone when you're sick. It used to be a badge of honor. Like, I've talked to my in-laws and they'll be like, I haven't seen a doctor in 25 years. And I'm like, that is not good. You need to see somebody, or at least know that you're checking your blood levels, running full panels. And I'll say the blood work and the testing we've walked through, I've never seen that in a traditional setting. To be able to dive deeper and gain a true understanding of my health and how to optimize my health and my lifestyle to truly live my best life and be as productive as I want to be and be there for everybody.
And being proactive, a lot of times we're finding things that people had no idea might have been an issue. You had a different story in that you were aware of a chronic condition when you started, and we do work with a lot of people like that. But as you were mentioning, even being more proactive and preventative, some things are so common that people tend to start to think they're normal. Like, oh, at 2:00, I got to go get a coffee and a candy bar or something because I'm crashing. It's the normal afternoon crash. Don't schedule me any meetings that too. But in reality, that's not a normal feeling. And sometimes when we're doing these screening panels for employers, we find things that are actually contributing, like insulin resistance or blood sugar problems, or even like Hashimoto's thyroid, that just really isn't part of a screening preventative physical, but they're really not uncommon. And we just need to get people access to the right data, and then access to someone who can actually go through it with them so that they can take actionable steps that fit into their life. I could go on, but let's get back into the employer side of things. And what does a modern employer health plan actually look like in your mind? You mentioned being able to incorporate certain solutions.
So if I was in charge of like blank slate, what would I do? If it were my company, what would I do? And what would I give my people access to? It has to start with a direct primary care or advanced primary care foundation to ensure that people have a primary care doctor who's going to help direct their care. Pair that with a functional medicine solution like Root that is available to all. You won't necessarily get 100% engagement because people have different drivers. Like for me, I really started researching when I got a diagnosis, when I had a death in my family of someone very close to me. It gave me the motivation to really start to take control of my health. And frankly, I wish I'd done it sooner. I will shout it from the mountaintops. I tell everybody I talk to on why it's so important. And something you just said, I'll give an example of that, right? Like, yes, direct primary care, helping people through the care navigation aspect of the traditional healthcare system when they need it. Definitely need a navigation solution onto that. But the functional medicine component is so critical. You mentioned like the afternoon crashes and stuff. So for me specifically, your nutritionist team, dietitian teams, it isn't just here's a printout, go eat this. Like, we ran your blood work and like, you can't have this, or you can have that, or you can have this. When we did all of my testing, I reacted to every food I was tested for. But my initial reaction was, great, I'm allergic to all food. So what do I eat? Yeah. And it's not that. There was an underlying issue with my gut balance that was causing me to react to all those foods. So what to eliminate to start, then what to incorporate back in. And I'll tell you, the amount that I felt better from doing that was insane. Energy levels, being able to, be productive all day. No more of like, oh my God, I'm brain dead at 2:00. I'm a morning chronotype. I can't really do stuff in the afternoon. All of that was gone. And then continuing to fine tune that to help me be on, productive, available, mentally there throughout the entire day was life-changing. And having that element for everyone, available to everyone, I think is critical. You can measure, as an employer, you can measure a return on investment on that to say, this is the percentage that have engaged in Root, and this is the percentage of productivity we saw increase across our people. Like, that is very important. And you're giving people a benefit that's helping improve their lives, not just helping them when they're sick. and
Right.
when they need to access healthcare, but truly giving them a wellness lifestyle tool that's going to improve their lives and make them a more productive employee.
Yes. Thank you. It's a great way to explain it because sometimes it's more than just the actual claims dollars, right? It's the stuff that's harder to measure, but so important and probably significantly impacting, the bottom line and having a happy, healthy workforce, which creates a better culture and is a more sustainable part of the health plan.
Yeah.
So,
And a lot of people are going the route of finding naturopaths, functional medicine doctors on their own. And most of those individuals do not accept, at least in my area, I should say, I shouldn't generalize across the country. Most of those individuals do not accept traditional insurance. And it then becomes cost prohibitive for those people seeking that sort of help, more proactive help, becomes cost prohibitive for those employees and their family members to continue seeking that care. So if you eliminate that barrier, the amount of chronic conditions that you can prevent from occurring, stopping people from turning into developing heart disease or going down the path of having a heart attack down the line, managing stress well, managing their diet, nutrition, exercise regimen, and truly working with a coach through that, giving them access to that is very empowering, right? We talk about employee retention tools, what people are looking for. You'd be surprised. Like I've talked to a lot of people who have gone down trying to find a naturopath or functional medicine doc, and then they end up stopping because it becomes cost prohibitive for them because they can't continue to access it. So we talk about retention tools. People will stay for things that are truly helping improve their lives and credit and loyalty to their employer because they're getting access to it through that.
they will. We've heard those quotes firsthand as well. A couple of things that you said, some of the reasons I love working with employers, and one is giving that access to everyday people who either never were aware that this type of medicine existed and could be validated and create real outcomes that they may have thought weren't possible. So that access that is given to people. And the second thing is that people change in community, right? Before we started working with employers, we were working with individuals, and then we'd end up seeing all their coworkers. I'm like, oh, I was referred by my coworker because I saw she made great change and I wanted to do that too. And so I think that's powerful, like giving access and then being given the same consistent philosophy of care that becomes just like part of the culture. And then we've seen entire workforces transform the way that they approach health because it's very powerful to have somebody individually guiding you, the right lab data, and people around you doing the same thing.
I couldn't agree with you more. And the amount of people like it growing by word of mouth should tell you something. Some of the best solutions in healthcare have grown through like water cooler talk and through word of mouth. And when someone is their life has changed so much that they are recommending their coworkers to see you guys and they're sending others to say, here's what was so helpful to me. And I've been able to take control of my health and do things differently. That speaks volumes, right? So why shouldn't that be made available at a larger scale so that more people can take advantage of it and avoid, the potential health outcomes, right? There's the nature nurture balance, right? You could be genetically predisposed to all of these conditions. Everything you do, everything you eat, your exercise levels, and granted, it's not always perfect, right? Like I travel a ton for work and, I have to eat. I mean, ideal scenario, I'd have greens on my plate and have X amount of protein and have my macros balanced per meal. And that just won't be reality. So accepting what your lifestyle looks like and working within that construct has been amazing to get to work with your team on how to go about doing that.
Meeting people where they're at is one of the things that we teach all of our clinicians here at Root. So this has been a really valuable conversation, especially sharing your own story and how that directly relates to employer health and how employers can actually empower their people through their health plan. So what's one thing that you'd like to leave the audience with?
I think I've mentioned this to you before, but I'm a big Ruth Bader Ginsburg fan. And again, butchering the quote probably, but within healthcare, we're doing a lot of looking towards policyholders, lawmakers to effectuate change in the pharmacy benefit management space and the healthcare space. But what Ginsburg said was a constitution as important as it is doesn't mean anything unless the people are yearning for freedom. And I think it's incumbent upon us as individuals, patients, community members to take control of our health and be empowered to do so. And also for employers to do the same, because 180 million people get their healthcare coverage through employer-sponsored coverage, none of whom could afford it if it weren't for their employers. So it's incumbent upon us to educate ourselves and ensure that we take control of our health to help to create some sort of effect in where healthcare costs are going, to ensure that we all can maintain access to the best healthcare that our employers can and are willing to offer, and for employers to do the same and give tools and resources to their people that can truly change their lives. And, oh, by the way, side products save a lot on their plan as a result, too.
Awesome. Well, thanks so much for being here, Kristen.
Thank you, Erica. This was wonderful chatting with you today. I appreciate you having me on.